problem, which kind of swiftly brings us on to treatment. So how do we treat reflux? Now, I've mentioned a lot about how food and lifestyle kind of affect it really, and that makes sense that actually changes to diet, particularly what we eat, when we eat, how much we eat, of course, is critical in the management of reflux disease. Absolutely a cornerstone. So we really emphasize the importance of looking very, very carefully at your diet and lifestyle, because you can make some significant inroads in treatment just by simply adjusting the diet and things like lifestyle, such as bringing the foot of the bed, bringing the head of the bed up. Some people sometimes have to put things like blocks to get it right up. Going to bed with a stomach that is empty, which means last meal maybe 5, 6, and then sleeping at around 9, 10 maybe. Pillows help. Certainly losing weight. Absolutely important to try and lose some weight to reduce the pressure. And measures like that certainly can help. Of course, stopping smoking if you happen to indulge in tobacco. So that really can make a big difference. Now, for the patients that doesn't work for, then of course there are things to add on to that, which would always things like maybe antacids, which would be the Gaviscons and so on, using omeprazole or one of the other proton pump inhibitor drugs, which do need prescription mostly, but are very effective indeed. And it is worth mentioning here now that they can be used in the long term being over a period of 5 or 10 years. And a lot of the scare or a lot of the press reports of problems with proton pump inhibitors or acid suppression long term is really, as far as I'm aware, data from about use over 20 years. And you get thinning of the bones and so on. So we're looking at short-term use, 3, 5 so years. I, at the moment, don't think it's a reason not to try at least to use these to control symptoms. You can sometimes use things that help to push the stomach contents out, which we call prokinetics, but again, not a significant number of patients do need to go and use these extra drugs. Now, of course, what are the foods that do come up as sort of culprits, as it were? Now, the important thing to say is that processed foods generally are a problem. And they would be frieds, of course, fast foods, pizzas, all the kind of foods that we can easily get our hands on. But it is worth being very careful, of course, if you are prone to reflux, to really pay attention to that. Now, unfortunately, some other foods are really tomato-based. Of course, citrus, we know. Chocolate, hard one. Very, we all like a little bit of chocolate. But of course, certainly, if you know that you're finding that these precipitated, then it is important to consider these reducing them or indeed eliminating them from the diet. Now, of course, it's important to mention they are good foods, apparently, that can particularly help. And these are fiber foods, which I've listed a few here. Alkaline foods also can be useful, and certainly home remedies. So these are things that definitely there's evidence to show that they can be really helpful. And without a doubt, I think a combination of different things is usually found to be more beneficial in kind of getting things under control, to allow at least ability to sleep at night, particularly ability to obviously make better choice of meals and improve quality of life. So I'm going to, if it's okay with everybody, go on to really surgery. So let's say you tried all the medical things and, the life quality, the, kind of concern is that or patient's really concerned that they don't feel that, or they don't want to have medical therapy permanently, then really we have to give consideration to surgery. And that's really where we come in the care or the management, basically, because of course as surgeons, we would really only be looking at managing in a slightly larger sort of sense patients who are either keen or good candidates for surgery. And the operation that really we tend to go for, which is the gold standard, I would say, is what they call the laparoscopic fundoplication. You know, and then with your surgeon, for example, the discussion is whether it's a complete wrap, which means 360 degrees, or a partial wrap, which I wouldn't get too technical as far as the purpose of discussion today is, but the point is surgery in the right patient, obviously with the right preparation, can make quite a difference to experience a quality of life, and of course reduce reflux.